When you first find out you have breast cancer, it's normal to feel frightened, overwhelmed, uncertain. During this challenging time, it is important to gather as much information as possible to determine the right treatment options for your disease. This video is about the Oncotype DX test, a test that will help you and your doctor determine whether chemotherapy should be a part of your treatment plan. The good news: breast cancer is a treatable disease. It is a disease that most patients can survive thanks to the great strides in treatment that doctors and researchers have made over the past 30 years. In addition, advances in the field of genomics have made it possible to characterize the unique biology of each patient's breast cancer and predict the likelihood that the disease will recur for that person. This knowledge helps physicians and patients tailor a specific treatment plan that avoids overtreating or undertreating with chemotherapy. Laurie, a writer and anthropologist, was no stranger to cancer. At age 28, she had been diagnosed with stage 3B non-Hodgkin's lymphoma. As part of her treatment for lymphoma, Laurie received maximum doses of doxorubicin, a commonly used chemotherapy agent. Laurie enjoyed excellent health for the next 30 years until an abnormality was detected during an annual mammogram. A biopsy confirmed that Laurie had breast cancer. After having surgery, Laurie and her oncologist had to decide whether or not to include chemotherapy once again as part of her treatment plan.
Because I had received a protocol that included adriamycin, I was at increased risk for cardiac toxicity, leukemia, were I to have to receive chemotherapy again. So the issue of receiving chemotherapy, whether I would benefit from chemotherapy, became a very, very big consideration in my case.
After surgery to remove their tumor, many women receive additional therapy, also called adjuvant therapy, to treat and help prevent the cancer from returning. That treatment may include radiation therapy, chemotherapy, targeted biologic therapy, and/or hormonal therapy. Hormonal therapy is often used to lower the risk of a hormone receptor-positive breast cancer from returning. Hormonal therapy typically blocks hormone receptor sites on cancer cells that multiply when stimulated by female hormones such as estrogen and progesterone. Likewise, other types of hormone therapy can be used to block the body's ability to produce female hormones. Chemotherapy uses drugs to kill cancer cells that remain in your body after surgery. A number of chemotherapy regimens are available for treating breast cancer, and while chemotherapy can be an important part of a breast cancer treatment plan, studies show that in early-stage estrogen receptor-positive breast cancer, only 4 out of 100 women have a large benefit from it. This means that if all these women received chemotherapy, 96 women out of 100 would not benefit significantly, if at all. Laurie's oncologist suggested that she take the Oncotype DX test to aid them in making the decision about chemotherapy. Oncotype DX is a genomic test that helps identify which women with hormone receptor-positive breast cancer are more likely to benefit from adding chemotherapy to their hormonal therapy treatment. The test also measures the likelihood that a woman's breast cancer will return or spread within 10 years, assuming she undergoes 5 years of hormonal therapy. This information, along with traditional measures such as your age, tumor size, hormone receptor status, and tumor grade, may be useful in helping you and your doctor determine a treatment plan that's right for you. The Oncotype DX test examines the activity of 21 genes within a tumor sample. The results of the test are reported as a recurrence score result, which is a number between 0 and 100. A lower recurrence score, in this case 5, means that there is a 5% chance that your cancer will return or spread within 10 years of your diagnosis. A lower recurrence score also means you have a cancer that is less likely to respond to chemotherapy, so you and your doctor may decide that the benefits of chemotherapy may not outweigh its risks. A higher recurrence score, in this case 44, means that there is a 30% chance that your breast cancer will return or spread within 10 years of your diagnosis. A higher recurrence score also means you have a cancer that is more likely to respond to chemotherapy. So you and your doctor may decide that the potential benefit of having chemotherapy now may outweigh its risks. In addition to the recurrence score, the Oncotype DX test provides specific measurable scores for certain individual genes, such as estrogen receptor, ER, progesterone receptor, PR, and human epidermal growth factor receptor 2, HER2. Knowing these individual scores, together with the recurrence score, can help your doctor recommend a treatment plan based on the specific characteristics of your tumor. When Laurie received her Oncotype DX test results, she was relieved to find out her recurrence score was 17. This score meant she had a relatively lower risk of her cancer coming back. Laurie completed radiation therapy and is currently taking hormonal therapy. Deborah, a painter, had no history of cancer when a 2007 mammogram revealed she might have breast cancer. A core needle biopsy showed that she had ductal carcinoma in situ.
They brought Randy in, and the doctor starts rattling off this stuff about, well, you have a high level of DCIS and blah, blah, blah. And it made no impact on me whatsoever except cancer. All the other terminology, I'd never heard it. It didn't mean anything.
My first hope was that certainly that Deborah would stay as healthy as possible. And my second hope was that the journey and whatever path that it ended up taking wouldn't be too difficult for her and for us.
After an MRI and another biopsy, Deborah was told a mastectomy was her best surgical option, since there were multiple areas in her breast with non-invasive breast cancer, and that it should cure her cancer. Unfortunately, the analysis of the tissue from her mastectomy showed that her cancer had broken out of her milk ducts and was in fact invasive ductal carcinoma. Realizing she would need to see a medical oncologist often, Deborah found one closer to home.
And she's looking over all the records, and she says, "Where's the results of your Oncotype DX test?" And I have no idea what she's talking about.
There are several types of breast cancer. The Oncotype DX test helps women like Deborah who have been newly diagnosed with breast cancer and are making treatment decisions regarding adjuvant therapy. The test is recommended for women with early-stage estrogen receptor positive, lymph node negative invasive breast cancer. In addition, postmenopausal women recently diagnosed with node positive, hormone receptor positive breast cancer may also be appropriate candidates. When your doctor orders an Oncotype DX test, the hospital will send a sample of the tumor removed during your lumpectomy, mastectomy, or core biopsy to Genomic Health's laboratory. You will not have to go through any additional surgery or procedure to get the Oncotype DX test done. The Oncotype DX test itself is performed on a small amount of your tumor which has been preserved or fixed and embedded in paraffin. The tumor is sectioned into very thin slices. These slices are then analyzed. RNA, part of the genomic makeup of the cells, is then extracted from your tumor sample and analyzed to determine the level of activity or expression of each of 21 genes. This measurement is done in triplicate. Finally, the results of the analysis are used to determine your personal recurrence score result. The entire process takes about 10 to 14 days to complete. This test should not be confused with BRCA1 and BRCA2 gene testing. BRCA testing determines if you carry a gene that caused your breast cancer to happen. Once your Oncotype DX testing is completed, a detailed report is sent to your doctor to share with you. Deborah's recurrence score result was a 33. Meaning she had a high chance that her cancer would come back. Her oncologist recommended she start chemotherapy immediately.
I had a score of 33,
which means a 23% chance of reoccurrence. So it was a no-brainer for me to say, well, yes, sure, I want chemotherapy.
We had been going on the assumption that Deborah's risk was really relatively low, and we felt good about that. The Oncotype DX test showed us that that really wasn't the case, and although that was quite a surprise, it was a relief to know what the real story was.
Because of consistent results in multiple clinical studies involving more than 4,000 patients, the Oncotype DX test is the only test of its kind recommended in treatment guidelines by both the American Society of Clinical Oncology, ASCO, and the National Comprehensive Cancer Network, NCCN. These guidelines were developed by medical experts to help oncologists and surgeons give their breast cancer patients appropriate care. Since becoming available in 2004, the Oncotype DX test has been ordered by thousands of doctors to improve treatment decisions for nearly 100,000 women worldwide. When you are dealing with breast cancer, the last thing you want to think about is whether or not your insurance will cover the cost of a needed test like Oncotype DX. The good news is most insurance carriers, including Medicare, Aetna, Cigna, United Healthcare, Kaiser Permanente, Anthem, WellPoint, Humana, Blue Cross Federal, and many others cover the Oncotype DX test for eligible patients. In addition, Genomic Health offers the Genomic Access Program, GAP. This comprehensive program helps you with the coverage process and provides financial assistance when necessary, based on eligibility. Genomic Health has a dedicated staff standing by to make sure that each patient has a smooth reimbursement process. To learn more about Oncotype DX, visit www.mytreatmentdecision.com or talk to your healthcare team. For insurance and financial aid or other questions about the Oncotype DX test, please call one of the following numbers.
After Deborah's test was done, we did get notification from our insurance company that the payment was denied initially, and then shortly thereafter we got another notification that it had been approved, and that really all occurred in the background without us doing anything. The folks at Genomic Health took care of all of that for us.
For tens of thousands of women like Laurie and Deborah, the Oncotype DX test is one tool that has offered peace of mind, giving them the knowledge that they were pursuing the appropriate treatment for their individual cancer.
Knowledge is power.
The test really gave me an opportunity to gather the kind of information I needed to make a responsible medical decision with my doctor. And it took the guesswork out of it. It was just one more piece of reliable information that we could then go forward and make the best decision possible for my particular case.
This made a big difference in Deborah's plan, a big difference in our life, and we are eternally grateful to the folks at Genomic Health for this test.